My next guest, Dr. Jeff Gross. We will be discussing stem cells and regenerative medicine and the potential for, let's say, turning back the clock on aging, or at least slowing it down and in some cases stopping it. Because being active and healthy for the rest of our lives is what we all want. It's not about living to 100. It's about living to 100 and being able to do all the things you want to do. So tune into this episode and learn about stem cells and regenerative medicine. And is this something that you should be looking into for yourself? Today on Stronger Bones Lifestyle Podcast, I will be speaking with Dr. Jeff Gross, a specialist in regenerative medicine. Welcome, Jeff.
Thank you so much for having me. It's good to see you.
It's good to see you. Yes, we had a recording that aired at the end of 2024, and it was one of the most listened to podcasts that I have, and also the short, so it was great. And I had a lot of comments from my community on how much they enjoyed the episode. So thanks for coming back to speak to us.
Well, it's my pleasure. And please, I'm always phone a friend for your operation, your podcast, your audience, whatever you need.
Oh, that's great. Phone a friend. Yeah, what is that show from?
Yeah. Who wants to be a millionaire?
Who wants to be a millionaire? Well, so being a millionaire is one thing, but we really all want to be in control of our health as we age. And so you're phone a friend for that.
Great.
Yeah.
Yes.
Okay. So at the end of our last discussion, you said to me, we didn't really talk much about stem cells. And I was like, oh yeah, because I don't really know much about stem cells. So I would like you to share with us, you specialize in regenerative medicine and also in stem cells, or stem cells being a part of that. Can you please explain what that means? What are stem cells?
Sure. So this is regenerative medicine 101, and it's really the specialty in medicine that focuses on how to help you heal and maintain and regenerate your body, which we do all the time. We have these stem cells in us. What's a stem cell, you asked? A stem cell is the basic building block that created us. When you are a fertilized egg inside of your mother, you're one cell, and that cell is a stem cell from which all other cells stem. So you divide into 2 cells and 4 and 8 and et cetera, and you're a ball of cells, and then you're an embryo, and then an embryo starts to look like a fetus. And all the cells that make up that fetus and the placenta and the umbilical cord are made of stem cells. And stem cells are super powerful at the beginning. Those are embryonic stem cells. They can make a person. And then as they develop in the womb, they're still amazingly powerful, but they can't make a whole person, but they could still make a limb. We're going to come back to that at some point. And then later, they're not as powerful anymore when you're born, but they're still amazing. And those are called multipotent. They can do a lot of things. They can become a liver cell, they can become a muscle cell, but they're not going to regrow a limb at that stage. But there are some ways to sort of induce them backwards along the embryonic pathway now that we've learned. And you can get them to from multipotent, more powerful, to pluripotent. And I don't know if anyone's induced all the way back to omnipotent or omnipotent stem cell, which is like when you're that one cell fertilized egg. But that's not regenerative medicine. That's what a stem cell is. But how do we use those to help someone? So generally speaking, it's a strategy. So we use these stem cells once we're born to help us grow and develop and repair and maintain. If you hurt yourself, the stem cells help you heal. When you need a renewal of your immune system, maybe after a big infection or maybe a low level on an ongoing basis, the stem cells in your bone marrow do that. There are stem cells in your bone marrow that make new red blood cells all the time, for example. That's how we renew our blood. And if you need to renew your skin, which we do all the time, or your liver or whatever, or if you're injured or sick, calls upon you. And if you're growing and developing, certainly you need these cells. Then as an adult, we still tap into these cells. Now, of course, as we accumulate exposure to our toxic environment, and yes, it's toxic everywhere. Things in our water we shouldn't have, things in our food source we shouldn't have, foods we shouldn't eat, maybe repair we can't do because we're not getting all the phytonutrients and eating right anyway. maybe electromagnetic fields, cosmic radiation, neurostress, poor sleep, loud sounds, who knows what else. All these things cause what's called chronic inflammation. So you hear that word inflammation a lot, but that chronic ongoing leaky inflammation is like a leaky gut, but it affects all our cells to the extent where they're not as healthy. They can't work as well. That also affects our stem cells, and our stem cells become less effective. And one of the theories of aging is stem cell exhaustion. They just can't keep us younger. They can't regenerate us. And that's why you have these sort of peaks in aging where all of a sudden you start to look and feel and behave older and more, senile-ish. So stem cells are an important part of our entire lives. But when they don't work as well, or you need some additional help in healing something you can no longer maintain, like a joint degeneration with related osteoarthritis and losing of the cartilage of the joint, then we can tap back into concentrating some additional regenerative stem cells or some signaling factor from stem cells, because there's other varieties of things we can get into. We can deliver them to that spot and help get a more youthful healing of that area like you used to heal when you were a child. Because children heal easily, right? A child scrapes his knee, cries, calls mom cleans it up, puts a Bactine and a Band-Aid on it, kisses it, and sends them on their way, right? And 3 days later in the bathtub, that the Band-Aid comes off and the scab's almost completely healed. But Debbie, you and I, we bang our arm, we have a bruise for 3 weeks. So why can't we heal like we did? It's the same body, same genes, same cells when we were 3 years old. It's because our cells are just not as good at behaving because they're damaged by chronic inflammation.
Yeah, so it's so interesting because you're talking first about going back. I mean, you said, has anybody gone to, was it omnipresent? What was it? Omni something?
Yeah.
The very, very beginning?
Omnipotent stem cells, yeah.
Yeah, it's really honestly, I'm thinking of the words root cause and what we all try to go to. It's really the why. So
Yeah.
going back to that, why, so first of all, looking at the cells, which was pretty amazing. That was something I thought was interesting that you said. And then I thought, you talked about the lifestyle factors. You talked about toxins and then leaky, whether it was leaky gut and you mentioned nutrient deficiencies. So it's really all of those lifestyle factors that contribute to breakdown. So it's understanding that plays a role, whether we're talking about not being able to heal a wound, or in the world that I work in, not being able to build bones or to build tissues like we used to keep us strong and healthy as we age.
Right. You're absolutely right. And that certainly overlaps into the bone health because, your bone health is only as good as your bone marrow. And your bone marrow is the main, not the sole, but the main source of your stem cells. So the seat of your renewal is in your bones. And if you do not take care of your bones, you can't renew the rest of your body. And you look at elder people with great bone density, and they are usually more youthful and have fewer diseases. So again, your bones are really your life source. The bone marrow, the stem cells, that's your life source.
Yeah, and it is inflammation. I mean, osteoporosis, we're coming to understand, is an inflammatory disease. So we're understanding that, and you're pointing to that inflammation we hear that word, but I don't know that people really understand it. And it is those lifestyle, chronic exposure to all those lifestyle breakdown factors that is asking your body to defend, repair, heal, restore, and it just can't do it anymore. It's the straws that break the camel's back.
Literally, yes.
Yeah, and that's so just on that note, because that's what you came from, and I love that you came from. So can you just say what you were doing, where you came from, and then why you shifted to where you are now?
Yeah, I'm a recovering spine fellowship trained neurological surgeon. So I still treat patients with neck and back trouble, disc issues, pinched nerves, quote unquote, degenerative issues, all kinds of things of the spine. Yeah, I treat the brain and nerves too, but I really enjoyed the spine. So I added regenerative medicine to my practice about 6-7 years ago in order to offer it as an additional tool for my spine patients, but it's blossomed into so much more. So now I don't treat as many spine patients because my time is taken up helping people avoid knee replacement, even if they're already quote unquote bone on bone or high stage degeneration of a joint. not just knees, but we look at all kinds of joints. We also do, inflammatory issues, people with a lot of inflammation in their body, whether it's from an autoimmune problem. Examples of that would be thyroiditis or, an inflammatory bowel problem or others. And other diseases of aging have inflammatory issues like Alzheimer's, a coronary vascular disease, of course, osteoarthritis and other arthritis type problems. And then people with inflammatory problems from chronic infections like Lyme's or long COVID. So these are people we also can help with regenerative medicine, with stem cells, or as I alluded to a little earlier, stem cell in the family of stem cells. So there are other things we can apply. For example, you can go very low level and use something called PRP or platelet-rich plasma for certain things. And that's something where we take it from your own blood. I'm not a big user of that because, and it can work in many settings, but if your body was already going to heal it, then taking it out of your blood to put it somewhere, may not be as effective because you're taking the same inflamed material and put it back in the inflamed source. It's like taking your car to get the oil change and putting the old oil back in it, But we can use it at a stem cell level. We can use something called stem cell signaling factors, which include growth factors you found in amniotic fluid and the cell-to-cell communicating particles called extracellular vesicles, or for short, exosomes. And we like exosomes. They travel better in tissue. Further, they cross the blood-brain barrier. They're a third of the price of stem cells, making these things way more affordable now here in the States. And they're more abundant. They come from amniotic fluid, so they're straightforward.
Okay, so that's really interesting about PRP. I know when I had my hip issues, I have a hip replacement. I had heard about PRP, and it really makes sense. You're taking your old inflamed cells and trying to ask them to do a job that they couldn't really do in the first place. So that's interesting. I know people still do that. So stem cells these are not your cells then? These are cells that we get from amniotic fluid?
Debbie, you can use your own cells. I'm not a huge fan of that. I do have some clients that have banked their own cells. There are a lot of doctors in the States who will harvest your own cells and use them on you. But, I'm 59. I've been on this planet. I've, consumed the water and the seed oils and things I shouldn't have been having for many years. So my stem cells are probably not as robust as they were when I was 18. So they're definitely not as robust as they were when I was born. So I would rather have fresh out of the box, unadulterated, uninflamed, perinatal donated material, which is highly regulated, screened, certified, tested, and safe. And when I do intravenous stem cell derived exosomes on myself, my wife, my family, we have felt safe with that material.
So this goes systemic. Does it know to go like to the area? Are you trying to target a specific area, or do you use stem cells for targeted, like in a joint? Or do you put it, because if you're saying intravenous, that's going systemic and going everywhere, right?
You're right. So we have different approaches depending on the issue. If I gave someone an intravenous dose of stem cell derived growth factors and exosomes, it's not going to target problem areas. It goes everywhere. It's kind of naive. They go everywhere. Stem cells do have a honing mechanism. If we gave pure stem cells, they tend to go to the source of the problem based on inflammatory cytokines that call for it. However, stem cells have the downside is they only last about 10 to 14 days in the body. They do not cross the blood-brain barrier. So if you have a brain problem, it's probably not ideal. Or a spinal cord problem, it's probably not ideal. And they're 3 times the cost of the amniotic products, the exosomes and the related amniotic growth factors. So I like to deliver those directly. So if you have a knee problem, we look at an MRI, I examine the knee, we correlate where the problem's coming from, and we target precisely and specifically where to deliver these biologics.
Okay, so these are biologics. So I've also heard that term also as biologics. So you said you can target them So explain that. Like, I mean, are you doing this for a shoulder? Like today, I was in class teaching a class, and I
Yeah.
told my class I was going to be interviewing you, and she has three torn rotator cuffs in her,
Yeah.
in three parts of her rotator cuff are torn.
Right.
And she
Yeah.
said, I don't want to have surgery. I'm trying to avoid it, but I'm not sure about things. And I said, well, I'm going to interview somebody to talk about stem cells. And she said,
No,
is that legitimate? Is that legitimate? Does that work? So
totally.
yeah, tell us about
Totally.
that.
And I'm not selling anything here. I have watched it happen. I have seen the results. We have before and after MRIs showing repairs of things, of tears and tendons and in thickening of the cartilage, regeneration of cartilage. So now, I can't make claims. And as a doctor, I've never guaranteed anything, of course, particularly as a surgeon, but I have examples and I've seen it with my own eyes. So I wish I had this tool my whole career. It is legit. You don't have to leave the United States to do it. It doesn't have to be cost prohibitive. It's safe. There's wonderful evidence-based medicine publications from around the world. I say around the world because we're late to the party here in the US. So you're looking at Europe and Asia where they're cutting edge. A lot of the protocols I follow have been in Europe for 20 years. This is not new. And that's why professional athletes have left this country over the years to get care. But you don't have to now. We have it here. And there's no, unethical, places where they're making babies just to harvest these things. The mothers deliver their children by C-section, congratulations. Then they donate the amniotic fluid, the umbilical cord, and things like that, which would have been trash, right? They would have thrown it away. So it is absolutely legitimate. Shoulders are a great example, especially in people who want to avoid surgery. There's a role for surgery, but man, if we can try with an injection to help prevent that, fantastic. Think of the cost savings and the downtime that we've saved and the risk factors and keeping people out of hospitals. And we hate hospitals. That's where the sick people are. You don't want to be there.
Yeah, you know what's interesting? When I had my hip surgery, at first I had a torn labrum and I got to see the image of that scope surgery.
Yeah. Yeah.
And it's so amazing because a lot of joints are not, maybe, I don't know, you could tell me this, I don't know, but joints are not necessarily innervated or have a lot of blood flow. Is that correct? I know the hip.
You're absolutely right. The cartilage is barely alive. In fact, I like to call the cartilage sort of the biological rubber, just the seal or the gasket. It has very little blood flow. There are few cells. In the same way that your hair is a protein product extruded by the follicle cell in your scalp, the cartilage is the protein product of a cell called a chondrocyte. That's a fancy term for a cartilage-forming cell that lives in the bone. So again, take care of your bones and they'll take care of your joints.
So when you're doing the stem cells, do you target, if you're going to, like, say we're doing a knee joint, are you targeting the cartilage of the knee? Are you targeting the bone cells of the knee? Or do you target it at all?
I do target for sure, very significantly so. But we don't target the cartilage in my practice because the European literature on this is crystal clear. There was a study that a few years ago, they published the 15-year follow-up. So they've been doing this a while. They took patients who needed a knee replacement. They were recommended knee replacement. Their knees were high stage loss of cartilage. Some people flippantly say that's bone on bone. And they said, hey, before you have this surgery, would you like to join our stem cell study? So the patients were like, sure. Or in France, oui. And half of them were assigned an injection to the cartilage in the knee, and the other half were assigned an injection to the edge of the bone where the chondrocytes are, just adjacent to the cartilage above and below. And over 15-year follow-up data showed that over 80% of the bone injected people were still doing great and no longer needed that surgery at 15 years, whereas the cartilage injected group, only 20%, low 20% were still doing well at that 15-year interval. So they proved that the bone injection is superior for benefit and for longevity of a joint regenerative injection or regenerative joint injection.
And that's what you do.
And that's what I do. Why would I mess around with something that's not going to be as effective? Let's do the best thing.
Gosh, this is amazing. So what I do, yoga therapy, teaching since 2010. I'd say that joint replacements, I have a hip. I think hips are great. That's one of the best ones to get. I think back surgery and knee surgery is so precarious, not always works. Really, really hard to regain flexion of the knee. Even though you don't have that chronic pain, you don't necessarily get your life back fully in the way you think you would with a knee. I mean, that's my experience. And I teach in the 50 plus crowd, but it's very hard to get full flexion back. And yes, you're out of the chronic pain, yet you're not healed in the way that you could be. So this just sounds really powerful for healthy, happy aging.
Yeah, I speak to some of the groups who are biohacking and longevity, the conferences. Some of them, people are seeking to live to be beyond 150. Well, if they can do that through the right healthy biohacking and living, great. But they're still going to have wear and tear of their moving parts. So we have to have a solution for people who want to live longer and healthier, because we want people who are going to be a healthy 90, 95 years old to be able to be mobile and active. And that activity is a key element in maintaining your bone density and your muscle mass and all the key factors for longevity.
Yeah, it's so true. I mean, we need muscles to be strong. And if you have any kind of joint issues, especially weight bearing, the knee being the number one, the hip number two, you're not going to move as much. And if you don't move as much, if you don't use it, you lose it. And then that's what happened to me at 50. Like my life, my hip joint collapsed at 50 after a torn labrum, and I had a scope and my joint collapsed. When I had my hip replacement, he said, Debbie, your hip was a bloody mess. And I think, yeah, there should be no blood in the hip joint. It's white and there's all the ligaments that go over it. It shouldn't be like that. And so I
Right.
have been broken. I know what it's like to lose that. And that's my life's work, is to help raise awareness to what happens. It's what you see, right? It's what you saw.
Right.
It's kind of, in a way, what shifted you from where you were. You were doing your
Right.
surgery and trying to repair spines in particular, all that pain and suffering and really low, poor quality of life. And that's
Yeah.
my goal too, is I feel like I got to that place, and I'm here to say, don't get there. And if you don't have joints that work, if you don't have knees that work, it's so, your quality of life, you can't play pickleball, you can't walk, you can't
Right.
hike, you can't travel, even sleeping is
Yep.
painful.
Yep. You're absolutely right. And some of the early work with stem cell derived exosomes was for bone health. It was for fractures that were difficult to heal, usually in someone with low bone density. And they were injected into the bone area and helped the fractures heal. And then the same group in France I was talking about also did a publication for people with something called avascular necrosis of the hip. Now,
Oh, wow.
for those of you at home that heard all those medical terms, what that means is the bone marrow in the ball of the top of the hip, the ball and socket joint, basically dies. It's dead bone. And if you have dead bone, you can't maintain your cartilage, and then the whole hip has to be replaced. And sometimes this has to be done in athletes. If you remember, the famous athlete Bo Jackson was known to have this problem because related to use of anabolic steroids, which can increase the risk of this condition. So what they did in France is they injected regenerative biologics, and I call these biologics and other people call them biologics because we want to make it clear these are natural. They're not made in a pharmaceutical company, although pharmaceutical companies would love to make them. So they injected these into the bone of the top of the hip, and they were able to restore the health and life and reanimate the bone marrow. And with that, got improvement in the pain and what have you, because they restored the ability to maintain and repair and regenerate the cartilage forming cells that support the lubrication and the cushion in that hip joint.
Okay, that's really, I did not know that. So are we taking like big pharma, big healthcare, big business out of this? Is this a whole separate, this is not being controlled by that entity?
Oh, they're sticking their fingers in it for sure now because they see it coming and they know they need to, monetize it. So right now it's not controlled by big pharma.
Okay, that's great. That's good to know, because I think that's where so many problems lie in my mind in medicine.
And a lot of people's minds, including mine. I mean, there are some good things, but there are also way too much overuse of medications and creating diseases for which only their medication helps, right? So the whole thing is crazy. Plus the conflict of interest and, involvement in lobbying and government and follow the money, right?
It's really sad. I mean, that's why I'm doing this. I know I said I was doing this for people to have better quality of life. And yes, that is true. But my big mission, especially with my podcast, is to raise awareness to how wrong we've done, especially bone health. It could be probably
Yep.
any other field. But what we've done with a DEXA scan that diagnosed a disease, a pill to cure that disease, and that was the training for this disease as the only tool for this disease for since the 90s, disempowering women, taking away their role in their bone health. It's maddening to me. I want to expose what's happened and
Great.
why we need to move away from that, which is why I love interviewing physicians like you that are not practicing bad medicine anymore.
Thank you. Well, wait a minute. That implies I used to be practicing that medicine.
Yeah. Well, okay, but the reason why I'm saying that is because that's the term they say to me. I mean, they're telling me I realized I was practicing bad medicine and I no longer wanted to practice bad medicine because I got into this field to help people. And Jeff, that is something that stood out for me in our first talk. You said this is not about money for you because I do think also that comes up, or it does in my mind, in the stem cell, if that word stem cell is used, I start to think of these opportunistic places that are popping up doing these 15,000 wait, what's it called? The female, a rooster, these rooster injections, these PRP
Yeah.
injections. And so
Yeah.
I always thought, okay, there's a money aspect where they're charging, all this money for something. Now you're raising my awareness that probably won't work because PRP is your old body that couldn't repair itself in the first place.
Right. Now, don't get me wrong. There are people with it's perfect for like a tennis elbow or something like that. Superficial tendonitis type things. It tends to help because you are concentrating it there. I don't want to completely throw PRP under the bus, but I don't waste time with it because it's so low end compared to what we do. So I leave it for all the other urgent cares and ortho docs who, think they're on the cutting edge of regenerative medicine. So.
Yeah. What would rooster?
A rooster comb? Well, listen, your joints need lubrication. That's made again by the cells in the bone. So if you get a little extra lubrication from that type of injection, hyaluronic acid, rooster, all these things, it can help improve the movement and less pain temporarily. Usually those come in a series, I think, of 3, and you have to repeat them every 6 months or a year. So that's okay. But if we can restore root cause, right, Debbie, restore the actual function of the cells that have maintained that joint and lubricated for so many years before, that could be a one and done and you're fixed. So that's really what I'm looking for and trying to do. Now, could we do rooster comb and exosome injection at the same time so that while the regeneration is taking place, which takes months, they have some improvement temporarily from the lubricating injection? Sure, why not? That's a cool strategy. So it's not completely unuseful to think of those things, but they are not fixing the root cause by themselves.
Okay, and you only need one of these injections?
Typically, it's a one and done when we're doing the joints, we're doing the bone edge. It's a one and done. And the literature supports that from Europe that I was referring to earlier. 82 point something percent of those patients were still doing great at 15 years. That implies there's 15 or 17 or 18% patients who may need another one down the road, but the goal is a one and done.
Okay.
No downtime, by the way.
No downtime.
No, I want people on their joints. I want them using their joints, stimulating the mechanoreceptors. I know you know that term, but for those of you at home, that mechanoreceptors are the small sensory, I don't know what you say, apparatus or sensory organs, microscopic organs that feel movement and pressure and stress. And they stimulate, bone and muscle growth and development by releasing small peptides and little proteins and growth factors that tell your cells where they need the work best, So where to toughen up, basically. That's what bone remodeling is all about.
Yeah, bone building, like a bone building center, like tapping into that bone building powerhouse.
Which is why weight-bearing exercise is one of the main ingredients for building bone, right? You need to stimulate those mechanoreceptors under stress. Bone has a certain elastic deformity, and you have to stress it.
Yeah, we have to stress it out positively, push and pull on them.
Yes, weight-bearing. Riding a bike will not do it.
Yeah. Well, see, I love yoga. And for me, I love like moving, I think moving the limbs away from the body and then challenging those joints to manage what's above when the legs are out to the side.
Yeah. Yeah.
Um,
You're getting some of that there for sure.
yeah.
But you really should add some resistance if you're not already for those who really need to build bone. And in my practice, we see a lot of people who haven't even looked at their bone mass. And why? Because, they just haven't been asked to. They haven't been suggested. It should be part of a screening process, maybe for women starting around age 50 or before. And I'm a big, big fan of bioidentical hormone management. I think you need that to maintain your bone. And it's easier to maintain it than it is to lose it and try to regrow it. I'm not a big fan of some of these pharmaceuticals to grow bone. They have all kinds of problems. And you need a good amount of vitamin D3. The sun alone will not give that to you.
Yeah, it's nice to hear a doctor say this about the different options, what's out there, and what really is beneficial. With the bone medications, they are not involved in the physiology of bone remodeling. They either like turn on a switch here or turn off a switch here temporarily while you're on them, but they're not actually a part of the whole game of bone building. And that's where the confusion is because there's doctors that are uneducated. Well, I can't say doctors that are uneducated. They're educated in the bad medicine route, right? They're educated by usually typically pharmaceutical companies that own medical schools or fund medical schools or are part of the
Yeah.
lobbying groups that are in Washington, D.C. for all of this, right? So there's a reason why the doctors that women go to that they feel bullied and pressured to take medications, they were trained that way. It's not their fault, it's a system. So to hear a
No,
physician
you're
tell
right.
us like what you're telling us about medications are not the way. Here are the things that can work, and the fact that the exosomes are biological. They are natural substances that are
Yep.
going to take us back to our baby stage.
You've been using these all along in your life. They're just not as effective now. And you think for those of you out there who have been pregnant in your later trimester, your hair is growing well, your nails are growing well, your skin is healthy and aglow. Why? You're getting a daily dose of exosomes through the placental membrane from the amniotic fluid. So that's an example of what we're tapping into. And, you know, you mentioned the sort of the bad medicine. I went to medical school and they taught us what they taught us. And then we drink that Kool-Aid and we're so stuck in our way. You take these smart people and they become so crazily close-minded. I don't know why. And it took me years to finally look another direction and see what else is out there and, see what's changed. And I'm part of a group now. We're trying to influence medical schools to include regenerative medicine in their curriculum. It's still barely there, if at all. And I wish I had this tool a lot earlier in my practice, this whole stem cell based medicine thing, because it's been a game changer for so many people. And I enjoy helping people this way.
Yeah, one doctor said to me, I feel like I've been a cog in the wheel of big
Yeah.
pharma.
Oh, yeah. I can see that. I've always butted my head up against the big machine and, the big crazy sick care system and the people that call them health insurance. They shouldn't get to use that word insurance. They should be the great, obstructors and denials of care. And I've always been a champion for, making surgery the last option. And now I have one more tool to do that.
Yeah, so where do you find this to be the most beneficial? Stem cells or exosomes?
Well, all of it. It's the low hanging fruit is joint degeneration. It's an early manifestation of too much inflammation in the body. Other issues that we see that tend to respond nicely are inflammatory problems of the body, like I mentioned earlier, the arthritis type problems, the inflammatory infections and age-related diseases that have an inflammatory component. The other group is mostly a preventative group. We have the people who want to not develop these diseases or slow the diseases, or maybe they're at risk factors and they want to slow it. And then we have a side project here. We have something special called natural killer cell exosomes, or NK cell exosomes. And we have NK cells as part of our white blood cells. Probably about 2% of our white blood cells are NK cells, natural killer cells. And they circulate around our body normally. Their job is to identify and selectively remove messed up cells like accidental cancer cells that we make throughout our life, and zombie cells or senescent cells who are boggy and leaking toxins, and taking up resources but not contributing. So NK cells are supposed to go around and remove these through their own exosomes. That's how they do it. Well, it's very difficult to get enough NK cells to make enough exosomes to have a therapeutic amount, but we now have access, and I have them here in the office, limited number of doses of NK cell exosomes that we are offering people who are looking for an augmentative treatment, a preventative treatment potentially, or an alternative treatment for cancer. And these can be injected into solid tumors. They can be given intravenous or both. And they have been shown in animal studies and cell cultures and used in a limited clinical way in other countries to deal with many types of cancer. So this is now no chemotherapy, no radiation, although you could have those things and do the NK exosomes perhaps in between your cycles. Or if you're in remission, you're at risk for having a recurrence, you might use it. Or if you're at risk because maybe a family member had something, or you have a BRCA gene or something, it might be the way to go.
Yeah, and we'll have in the show notes how to find you for those listening saying, wait, I need an NK. I'm thinking NK, natural killers.
Yeah, that's what natural killer cell, NK cell exosomes.
Is that what they're called?
Yeah, an NK, natural killer. Yeah.
Oh, I don't know if I knew that. Maybe there's like a subconscious thing. I'm like, oh, well, NK sounds like natural killers.
That's what they are. They're natural killer cells. They're a very specific aspect of the white blood T cells family.
You know what's really amazing about prevention, and this is what I think is important to raise awareness to, we don't always realize that our knee bothers us, or maybe back shows up because quite often I think there's more nerve involvement there with back aches. But we don't always realize that we're not able to move as much as we used to, or as freely as we used to, because our hip or our knee or ankle or something's bothering us. And as you said before, we need that mechanoreceptor stimulation to stay strong and mobile. So it's like you don't really realize that this is happening, but the earlier you realize that and the earlier you nip it in the bud, you're going to actually always be able to stay in that strong zone and stimulating the mechanoreceptors. And it's so important for that quality of life, for mobility, to be able to live an active, full life. And I'm sure you see this in what you do and what you do and what you did before, the types of patients. Have they changed, by the way? That your mindset of now doing this regenerative, do you see a different person that comes in your office than a person that used to come in your office?
Totally. We have people now that I'm doing this, that are seeking this out. They're usually more health-minded instead of sick-minded. They're looking for non-surgical options. They're looking for someone who's not still drinking the Kool-Aid, the big pharma, institutional, watered down, U.S. sick care system Kool-Aid.
Yeah. And I see that what happens if you don't do this. And I'm like, don't get there. Okay. Best applications for stem cells as the last question.
No worries. The joints, as I mentioned, the inflammatory issues, as I mentioned, the preventative issues, as I mentioned, and then we do a few other little things. We have some cosmetic uses for, we do microneedling in the face. We could do it for the scalp for thinning hair. We have shots for men and women wanting to improve things in their sexual health as well. We've done that many times, and people enjoy those benefits. And then we do some specialty things depending on your needs. Like I have one person who had radiation damage to a salivary gland from thyroid radiation treatments. So we were able to inject the salivary gland and get some response out of it. I have people who were slowly having chronic kidney failure and they were being told they're going to need dialysis. We've been able to keep them off dialysis. I had a person who had to go onto oxygen for chronic bronchitis, and she stopped leaving the house because you have to drag your tank with you. And we gave her a breathing treatment of the exosomes, and she has been off oxygen now for, I think, about 2 years.
Oh my God. So lung regeneration.
Lung cells. Sure. Why not?
Wow. It seems like the sky's the limit here.
Well, I mean, I'm very excited about this. I hope people are too. But we use it cautiously. We don't want to have crazy expectations. We want to try things. There's really no harm in trying this. And we do all kinds of different applications, and we customize things for people. Why not? Here's a little bit of youth. Where do you need it? And that's what we're seeking to do.
Yeah, and I'm sure you couple that with the lifestyle part too, because you can't just keep, it's just like the bad medicine path. Like, here's the pill to manage the
Yep.
disease, here's the pill to manage the disease,
Yep.
here's the pill, and now you have another disease, here's this pill and this pill to manage this disease. But
Right.
if you don't bring in, if you're going to go that route and use stem cells or exosomes, then you also need to bring in the positive lifestyle support.
We like to do that first. We want people, I think they get a better response if their cells are optimized. So we like hormone optimization. We like the right diet, sleep, exercise, everything. We like to dial it all in first to make sure they're doing everything they can to suppress inflammation. Because if we do a treatment, but then the person's smoking and drinking and not exercising, they're not going to get as much out of it. So we want them to have a good result. We want to stack the deck. We can be biased towards a good outcome here. We want to help people get it.
Yeah. And they can if they come to Las Vegas.
They can. Well, most of what we do is remote first. We only invite people here to the office, and we are in Henderson, Nevada, which is right a suburb of Las Vegas. We do invite people here only when they're a candidate to do something. So a lot of what we do in ordering labs and MRIs and things, and we do by remote video now because it's so we have the technology. COVID has given us that, if not anything else.
Yeah. All right. Anything else before we end today?
Yeah, don't take no for an answer. Keep moving. Keep asking. If your doctor says no, it's not, stem cells aren't proven. And I still have people come in saying their doctors say stuff like that. And who knows, maybe I would have said that 8 years ago, but that means that doctor is speaking to you from medical school, which might have been 25 years earlier. So you might want to find someone who is more updated. You can seek out regenerative medicine or people like me in every major city in the US.
Yeah, I always say find a new doctor when they're being pressured to take medications or bullied to take medications. Or the
Yep.
big thing
Bullied.
now, BHRT, bioidentical hormone replacement, really is the preferred choice by most functional medicine physicians in the bone health world. And
Yep.
if their physician doesn't agree with that, I'm like, well, that's just because they're not up and current on the latest about the Women's Health
Yeah,
Initiative.
no, I mean, most gynecologists don't even know how to do it. Most endocrinologists don't even know how to do it right. They're busy treating massive thyroid disorders and things like that, or pituitary issues. So yeah, you got to go to a functional or naturopath or an anti-aging doctor. The Women's Health Initiative was completely biased and wrong. They're now admitting that quietly. It's out there. You're absolutely right.
Yeah. All right. Well, thank you. I can't wait to air this and to share this. So many facets, not just stem cells and exosomes, but your message about
Thank you.
healthcare and all of that too. So thanks so much for speaking with me today.
Thank you for having me again. Take care.
Thanks for joining me on Stronger Bones Lifestyle. Are you ready to take charge of your future? For show notes, resources, and information on my programs, please visit DebiRobinson.com. If today's episode empowered you, be sure to subscribe, leave a review, and share it with someone who needs it. Together, we're building stronger bones and stronger lives. Take care, and I'll see you in the next episode.